I'm Dr. Christina Conolly, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges we are faced with today. I have with me today two guests. First, we have Ms. Laura Mitchell, who is the chair of the Substance Use Prevention Committee with the Montgomery County Council of Parent-Teacher Associations, or MCCPTA, and co-chair of the Montgomery County Alcohol and Other Drug Abuse Advisory Council Prevention Subcommittee, and Mr. Ed Clarke, who is the Chief Safety Officer in MCPS. Thank you for joining us today.
Thank you for having us.
Thank you, Dr. Conley, for allowing us to be here today.
All right. Glad to have you both. So my first question, and I'm going to turn this over to Laura. Can you share what families can do to remove or secure certain substances in the home?
Sure. It's really important to secure these substances or remove them from the home. And some of these things we don't always think about. It's important that if a child has an impulse or a curiosity to experiment with alcohol or drugs or any other thing, or to escape from whatever's happening with them, that we don't have the means available for them to do it. Getting rid of old medications that you have in your home from your broken leg or your surgery that you had 2 years ago or something like that. It's very, very important. 2/3 of teens who misused pain relievers got them from their friends or their family or their grandparents' medicine cabinets. So we need to get rid of those. And many teenagers, many adults even, think that prescription medications are safe because they're prescribed by a doctor and they're professionally made, but they can also be deadly. So it's really important that we dispose of those. And if there are medications you're still taking, they should be locked up in a safe. Don't rely on hiding them in certain places because they can still be found, trust me. It's important to make sure that they can't get to them at all. They're even locking pill bottles that you can get, medication bottles that you can get. And when you're getting rid of those medications, it's very important to do that properly. There are drop boxes at every police station in Montgomery County, the Montgomery County police stations, and many of the pharmacies, particularly CVS, they have these drop boxes. You can put unused medications in. You don't have to have contact with anybody. You just drop it in the box and they're safely disposed of. Never, ever flush them down the toilet or the sink or just throw them in the trash because they can be contaminants. You want to use something that neutralizes that, like a doTERRA package or something along those lines. As far as alcohol goes, many of us don't think of that as a drug, but it is. And it is often abused. By age 15, almost 30% of teens have had at least one drink. So if you think about that, that's a lot. That's a lot of them. And it grows exponentially as they get a little bit older. So we want to make sure that that is either removed from the home or, again, secured in a locked cabinet and that they don't have access to it. And this is important whether you're working in a different part of the house or if you're working outside of the home. Many parents have gone back to school and our teens and tweens are home alone all day. So they really need to have those items secured. Another item to consider is tobacco. If you're a smoker or a vapor and your children are seeing that and it's around the house, it's very easy for them to pick it up and try it out. Mom and dad are doing it, or mom or dad's doing it, or someone else is doing it, a friend, and they get curious. And particularly with the vaping, they smell good. They are very enticing sometimes to our students. And we want to avoid having that around. So again, lock those up in that same safe with those medications, maybe in the cabinet with the alcohol or somewhere where they can't get to it. If you can't remove them from the house completely, make sure that they're locked up and out of the way.
Thank you for that information. Definitely very helpful for our families who, because we're all still in the virtual environment at the timing of this video. So my next question is for Ed. So we're receiving information about families who are concerned about suicidal ideation and online bullying and harassment. What are some strategies they can do at home to support their children when they experiencing these things?
Well, Dr. Conley, you provide a lot of great training to us in MCPS dealing with issues of suicide, bullying, cyberbullying. I think the number one thing is now we're not in our school buildings. So for parents, other older siblings or other caregivers, just to be aware of what's going on with our students in the homes and in the community. If they see sort of difference in behavior, if they see impulsiveness, or maybe some sadness, then that might be an indication that something's not really going well. So then reaching out to other members of the family, maybe contacting the school counselor, the school administrator. We know that there's community-based resources out there, the Montgomery County Crisis Center, there's other hotlines, but just don't sit idle. Don't overreact, but just kind of be aware of what's going on out there. I think in today's world, we're all a little bit out of sorts. So just being a little bit more aware of what's going on. And if you see any changes, either overt, subtle, or drastic changes, that may be a clue for us to kind of respond to and to reach out to someone in the mental health community that can give us more guidance or support.
Thank you. And to follow with that, Ed. And I'm curious, and I've been hearing things around, like, families have been asking, so what do they do? Let's say if they have a child who's suicidal and they have weapons in their home, is there anything that they can do to help to get them secured?
Well, we've got to be smart. There's a state law that requires those loaded firearms to be properly secured in all of our homes. Don't take any chances. As Laura was saying, don't allow that access to things that could injure our students and our children, and especially loaded firearms. We really have a responsibility as the adults in our homes to do an exceptional job of making sure those loaded firearms are secured, or any other type of weapons. The other thing we want to be aware of, we know that the kids aren't in school, our students aren't in the school, but still be aware of the cyberbullying that's out there. Most of our children or students do have access to cell phone devices or tablets. So be that inquisitive parent in your homes, just in making sure that appropriate use of those devices continue, just like you would during us being in the school building. So again, cyberbullying is still a concern for all of us out there.
All right, thank you. And is it true that the Montgomery County Police Department has a way of supporting families? So let's say if maybe they don't have a locked device, but in this immediate moment, they need to have their gun secured for their child's safety?
Yes, we can reach out to our Montgomery County law enforcement partners at the high school level. We have our school resource officers, so parents can reach out to the SROs. They can reach out to the local district stations. If you live in the city of Gaithersburg or Rockville City, where we have municipal law enforcement, you can reach out to those police agencies. They're there as part of their community policing initiatives to support families and provide good guidance, or provide those devices that can properly secure those firearms there. So don't take a chance. Reach out to someone in law enforcement for guidance and support.
All right.
Because we don't want to see a tragedy occur in our homes or in our communities.
Absolutely, absolutely. As we look at the data, so the number one used method for suicide is with a firearm. So especially if you have a child who's suicidal, we need to make sure we appropriately securing those weapons. So my next question is for Laura. So what can families do to stay physically and mentally healthy during this time?
Well, there are a number of things that we can do. One thing is getting breaks from the screen. We are spending hours and hours looking at our screens. They're looking at their screens. Take some breaks. They get short breaks between classes. Work out some fun things. Running up and down the stairs might not feel fun, but it feels good to the body and gets those endorphins going. Take a walk outside during your lunch break. Go up, sit outside and have your lunch, or encourage your students to. One of the fun things that we really love doing are dance breaks. So we just crank the music up as high as it'll go, maybe. And to use those short breaks in between is do dance breaks. It's great to get exercise in. It gets everything moving. It gets them awake. It gets you awake. And music just makes you feel better, makes you really happy. At least it does for me. Another thing is making sure that your body has the fuel that it needs. Even if they don't feel hungry, I likened it to a broken gas gauge. Just because the gauge says that you have gas, if it's broken, you still have to fill the tank up. So making sure that there are healthy foods around, healthy snacks that they can eat. lunch, a good lunch, breakfast, all of those things, making sure that they're ready to learn in the morning and in the afternoon. We try to focus on breakfast a lot, but it's important to have a good lunch as well, and healthy snacks so they don't grab junk food that makes them feel sluggish and not really want to be as active in the afternoon. And the last thing is really making sure that you are having meaningful conversations. Ed mentioned with the firearms, and we talked about some other issues, that we need to be aware of what's going on with our kids. And particularly in middle school, even high school years, they may not really be opening up to us the way they did when they were little. And so we have to prompt them a little bit. And so one of the things is having these conversations. They're great conversation starters. There are a few questions in the presentation, but you can buy a deck of cards basically from Amazon or anybody else. And they have questions, open-ended questions like, some of them, who did you play with at school? We're not doing that right now, but maybe who did you play with online? How were you kind to someone today? Things like that they have to think about what they did in their day, and it kind of sets an expectation for them as well, but it gets them out of their own little world and makes them think about their place in the bigger world. That's how you know when there's changes in their behavior, their thought process, or their attitudes. And you can address these things a little earlier sometimes if you're having those regular conversations. And a walk is a good time to do that.
No, thank you. And I like the Amazon cards. I haven't heard that, but I like that idea. Thank
Yeah, sure.
you. I might go buy some myself. Okay, so
Yeah.
and so this question is for both Ed and Laura. So do you have any suggestions or feedback for families and students to help them during the crisis, especially in terms of helping them with resiliency?
Well, I think that with resiliency, they need to know that it's okay to not be okay all the time so that they don't get stuck there. And being able to talk with your kids about what's going on and how it impacts you, and sharing that, hey, I'm anxious too. And let's talk about what's doing that to us and how we can do some deep breathing or different things that we can do together to look at that. There's great information on the MCPS website about signs of suicide. Every student in Montgomery County gets some version of that. It's age dependent. And I encourage parents to look at that information as well, because there are things that maybe it's not even your child, maybe it's a friend of your child, and they're struggling with what to do because the friend has said that they're feeling out of sorts or they're feeling like harming themselves. And but I think the biggest thing is not to be afraid to ask, are you thinking of harming yourself? And are you thinking of killing yourself? Because those are two very different things. And if they're not really open to talking about it yet, they will say, no, I'm not thinking of harming myself, because killing myself is not the same thing. So you really need to ask both questions, and you need to be very direct. You're not going to put an idea in their mind by asking the question, but you need to be very direct.
And I think finding fun things to do as a family, getting out there exercising, eating healthy, understanding that all of us in this COVID-19 pandemic are really struggling. Anxiety, depression, we're just out of sorts. So I think having those ongoing regular conversations, not forcing the conversations, but being available. Parents talking to other parents, students talking to other students. And I think also for all of us, how do we develop more patience and understand what we're going through? And I would say too, find a way to express your love for your children. Make time, give a hug. It doesn't matter what age. Let them know we're all in this together. We care for one another. Being polite to everyone. Just understanding that it's a very challenging time, and we all have to stay together and just work hard together to make sure we're going to push through. And we all will get through this.
Yeah, we frequently do the exercise of put yourself in the other person's place. When we hear a comment or something like that, how do you think that made them feel? How would you feel if you heard a friend telling you that or a classmate telling you that? And just building that empathy, because I think that goes a long way as well to making them stronger people and kinder people.
And Dr. Conley, the other thing that I might add is if someone is unsure what to do and who to report certain concerns to, we've got a variety of hotlines. Don't wait. Be a good person, reach out, express what you think is going on, and then let the adults or the professionals do the follow. We want to make sure that we don't err. We want to err on the side of caution and
Absolutely.
just report your concerns to a caring adult or a trusted adult.
Absolutely. Too many times things are brushed off or excused as though they were joking, or I don't think they were serious, but you don't know. And it does take a professional to determine that. And they know the right questions to ask. They know how to observe the body language and all of those things. And having been in that situation as a parent, you want to make sure that you're asking the right questions and that you're asking for help early. And the crisis hotline is an excellent source. There are a number of others listed in the presentation that you can reach out to, or just call your school counselor. Or, if you need to call 911, then call 911.
Absolutely.
Take them to the hospital. They know what to do and they can help.
No, and thank you both for both of your feedback and information. And yes, we always want to make sure for our families and students watching this, like even if you're unsure, it's better to ask. And folks in the school, folks on the hotlines, or even the hospital can consult with you about, like what to do, like what are the next steps? Because if you get a feeling in the pit of your stomach saying something's wrong, more than likely something is wrong. You have to trust your gut, trust your instincts.
Yes.
And there are a lot of people within Montgomery County here to help you if you feel like that. I mean, even for me, like I get calls from families saying, well, my child got a message from somebody on social media, and what do I do? What are the next steps? Can you help me with that? And that's perfectly fine. We want you to do that so that we can get help to those in need. And it may be nothing, but what if it is? And so we want to err on the side of caution to try to make sure we're looking out for the safety of all of our students. And so we want to be able to be there to support you during this time. So, and so I do want to thank Laura and Ed for your time with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on our show, please visit the link on your screen. Also, please go to our YouTube playlist to find additional shows in our series. And please join us next time on MCPS Waymaking.